Hi, and welcome to Parks Associates Connected Health Summit. I'm Jennifer Kent, Senior Vice President and Principal Analyst with Parks Associates, and so pleased to be kicking off this session today. This is 40th, we're celebrating our 40th year with Parks Associates as an organization, and we've been hosting this Connected Health Summit for many years. It's been fantastic to see all of the great innovations and progress that the space has made. Today, we are focusing on enhancing independence, safety, and security for seniors, talking about the convergence of health and home and broadband and connected devices and new intelligence layers that are making new experiences possible for consumers, for older loved ones in particular, for their family caregivers. This series is one of several sessions that are part of the Connected Health Summit series. We would love to have you back on June 16th discussing designing the future of PERS, as well as on December 10th when we're looking at connected senior living and the in-facility technology story as well. And with your registration here today, you're already pre-registered for those other sessions as well. So you'll see some reminder emails from us. We'd also love to invite you to any of our events, our executive events that we host across the year. So in addition to Connected Health Summit, our flagship conference is Connections, which we just hosted in Santa Clara, California in May, which covers the whole connected home space. We also do a one-day version of that called Connections Summit at the Consumer Electronics Show in January every year, and excited to be back there in 2027. Next up, though, is our Smart Spaces event, which focuses on multifamily, including senior living and senior community, 55 plus type communities. And that happens in Dallas in September. And so we'd certainly invite you all to join us in person to talk about the technologies, the experiences that properties are interested in bringing in as part of the resident experience when we think about 55 plus communities, as well as as the acute care needs grow across that continuum of senior care, how the properties needs change and the staffing needs change as well. Big thank you to our sponsors. Thank you to Alarm.com, to Beckler, and to Silicon Labs for your support of Connected Health Summit. We couldn't put on these sessions and these great discussions without you. Today, I'm going to start off by sharing a little bit of our research here at Parks Associates in the connected health and senior assisted technology market space. And then we're going to invite David Moss, who's the CEO and co-founder of Care Daily, to join us for a keynote session and sharing. They've had a lot of great announcements and partnerships that they've announced recently, and so very excited to hear more about how they're seeing this market develop. And we're very excited to take your audience questions and have some discussion with David. And then we're breaking out into a full panel discussion talking about the new front door for care, bundled smart home solutions, with fantastic speakers really coming from a variety of perspectives from Mitrex, Boston Children's Hospital, Be Well, and K4 Connect. So please join us for that panel discussion. Throughout all of our sessions today, we certainly welcome you to add in your questions. There is a Q&A tab that you can submit your questions, and as we're able, we'll take some of those questions as we go today. And if we're not able to get to all the questions, then we'll follow up afterwards. Okay, so I'd love to start by sharing a little bit of research from Parks Associates and what we're seeing in the connected health and particularly senior support space. We did have a study that published recently called Assistive Technologies for Older Adults. And in that, and really our research throughout the year, we're able to see what consumers' needs are, what seniors' needs are, how are they engaging with technologies. And we've been studying this space for a long time, so we're able to see that in a trending way as well. So starting off with just the connected device landscape, when we think about health and wellness, we've certainly seen growth in use of a variety of different technologies across the board. Here you can see there's a mix of what we would consider wellness, fitness, support type devices versus medical, like a connected glucometer, wireless cardiac monitoring device, thermometer. The smartwatch has been really a leading device, interesting to consumers, not only because it includes communication capabilities and notifications and connection into the larger smartphone ecosystem, but certainly at the core of its value proposition is understanding health and wellness better, from your activity levels to your stress levels to sleep activity, and the ability to understand where you might have some potential issues, cardiac, for instance, and raising that to go see that with a doctor. So we now have 38% of consumers in US internet households telling us that they own a smartwatch. But again, you can see there's really a mix of form factors out there in these devices to be able to detect your vital signs, and other aspects of your well-being and your lifestyle are more available than ever. And when we look at the senior market specifically, and the caregiving market, we continue to see that this is a large and growing segment of the population. In 2025, we have 30 million consumers in US internet households that have self-identified as a caregiver or anticipating caring for an older loved one in the next 5 years. And that can be a spouse, that can be an older parent, some other older loved one. And many of them tell us that they are using technology in their, among, the many resources they have to bring together to care for that older loved one. And the percent and number who are using technology in their caregiving role has grown as well. So we have about 16.3 million US internet households that are using assistive technologies for caregiving. And they are using a variety of technologies. So certainly personal emergency response systems, PERS, smartwatches, mobile SOS apps, sensor-based systems, very application-specific devices like fire shutoff, stove shutoff, fire safety type devices, and a variety of other kind of smart home devices, along with services like monitoring, particularly for emergency support. Now, one thing that we see as being particularly critical in the benefit of using connected devices as part of that role in caregiving, and even for the self as a consumer, and all of us trying to live healthy and well lives, but particularly in the caregiving role, is the ability to have insight when you're not there, and even have control and have the ability to react and help and assist when you're not there. When we ask caregivers who are caring for somebody who does not live in the same home as the caregiver, 56% say that they are providing some sort of care daily or multiple times a day, even though they don't live with that person. And that obviously gets harder and harder the farther away you are for them. And so these technologies help close the gap, alert to issues, bring people into that caregiving role or that support role, even though they can't necessarily be there in person. What's interesting is when we ask family caregivers what different devices that they're using for supporting their older loved ones, we do see, I think it's just over 50% now say that they're using at least some sort of assistive technology. And that means that there's actually more people that are using technology devices and services today to support them in that role that are using actual care professionals. We know that there are lots of staffing constraints with home care agencies, for instance, and the costs that go along with that. And not everybody is able, or maybe at that point of really needing somebody to physically come into the home for professional care support. And so relying on a variety of technologies to kind of meet that caregiver and the loved one where they are. Also interesting, in this recent round of research, we saw that folks aren't necessarily sticking to one type of technology, particularly in this area of where they live and how much assistance is needed. So those who live independently and need assistance, and those who live independently but probably shouldn't, so they're right on that verge of maybe needing to be in a senior living community of some sort so that there is on-site assistance, but for whatever reason isn't able to be in that type of location or have that type of support, are most likely to be using technology to help them, but also be using multiple types of technology and trying to kind of piece a solution together to help get the support that they need. Now, we are in a new world where intelligence is being added kind of across the board in many, many different innovative, interesting ways to bring together the data that connected health devices are unlocking and make meaning and understand context out of that data. And importantly, having ways in which the data actually talks to each other through interoperability efforts, right? To actually get to a place where we really understand more of what's happening from that data. And so we see AI being applied not only actually from understanding the data patterns to make more meaning out of the data that we're collecting, but also now on the user interface side to allow the end user, whether that be the caregiver or the older adult themselves, to more naturally query what's going on with them and interact in a way that feels natural. And some of this is still very experimental and new, but it's interesting to see how many people already are using LLMs and chatbots even in their personal lives. Many of you, I imagine, are using them professionally for a variety of different tasks in your day. But we are studying how consumers are using AI throughout the year. Really, every quarterly wave of our survey of 8,000 US internet households now, we are asking about AI usage and reporting that out through our AI experience dashboard. And the speed with which we've seen consumers reporting that they're using AI after only just a few years on market has been really remarkable to watch. We have 58% of consumers in US internet households telling us that they use AI today. An additional 10 to 15% are saying they're not using, but they're familiar. And you can see that's up just from 40% in Q1 2024. So pretty dramatic rise in usage. And that is across personal and professional, and even for those who are students in their educational studies using AI tools. So in Q1 of this year, we went deeper specifically on the connected health and wellness side to understand whether or not, are we just all asking AI again to help with work tasks or, kind of little information grabs, or is anybody really using these AI tools to better understand their health and their wellness, or that of somebody, perhaps a loved one? And we found that 73% of that 58% who are AI users are asking health-related questions. That equates to about 43% of all consumers in US internet households using AI today to ask health-related questions. And we said, okay, well, what are you actually asking about? What are you diving into? And these were the top 10. I think we gave them 15 different options, but these were the top 10. The first is just general health information, very symptom explanations, understanding kind of what's going on with me if I feel a certain way, nutrition and diet guidance, fitness or workout advice. But then we start getting into some of the more medically specific questions. How about this medication, the side effect that I'm answering? Asking about mental health information. Help me understand a diagnosis or even a lab result. And then interestingly, also guidance related to chronic condition, emergency related questions. We really want people to of course, quickly ask for emergency support in that instance. But starting to use chatbots as a first place to understand what to do and what to do next. And then interesting, even parenting advice, right? Advice on caregiving for a child or a teenager. So it is just like we've all, there's Dr. Google, right? And you might use Google to understand kind of basically what might be going on with you. That same type of behavior is translating over into these AI tools. Now, it is the frequency of using them for health-related questions is a little bit age-dependent, as is sort of all of the use of AI right now. As you might imagine, younger consumers are are heavier users of AI tools than older consumers right now. But we do have 60% of those who are 55 and older who are already using AI tools are asking health related questions. So, as is often common in the senior story, people underestimate how much seniors do use technology, and especially those adult caregivers using technology. And we have to expect that they're also going to be needing support and be asking really interesting questions and engaging with these AI tools as well. So we have seen just a few more points here. We have seen that the market is responding, and we've seen AI leaders, shifting from general AI to specialized healthcare platforms. We saw Amazon launch Health AI, an AI consumer-facing health assistant integrated into Amazon's app and website. We saw OpenAI launching ChatGPT Health, which is a consumer health layer inside ChatGPT. We saw Anthropic launching Claude for Healthcare this year, which is a healthcare focused AI platform for both consumers and enterprises. And we've seen companies like, we'll hear later, like BeWell, who are also making connections with these LLMs to make sure that your information, can be surfaced and meaningful and queried for you in the way that makes sense for you. Okay, final piece of data here that I wanted to share is that we also tested what would be valuable for an AI assistant to do for you on wearable devices. Now that could be a smartwatch, it could be a fitness band, a smart ring, even hearables like an earbud or headphone set that are quickly becoming more smart and also hosting assistants. And that runs the gamut between productivity things as well as health things. And again, as you can imagine, most use cases are more appealing among younger adults, but the thing that seniors are particularly interested in is having an AI assistant that can provide emergency assistance directly through that wearable. Again, whether that be a PERS device or a smartwatch or a fitness band. So we're in early days of exactly how consumers are going to be engaging and interacting with the AI layer, or even if they have to at all, and whether or not the care providers or monitoring providers, remote patient monitoring agencies, are able to see patterns and leverage this new intelligence to make connections and make sure everyone's getting the best care that they can get. Okay, final note here is we are surveying, actually right now it's in field, to get a more ecosystem view, not only the consumer view. We're surveying senior living community property owners and operators to understand their needs when it comes to caring for residents and their technology and the prop tech, and the operational technologies and the health technologies that they are investing in today, and their experiences and what they're looking for from their vendors. And so that research we'll be sharing later in the second half of the year, and also at Smart Spaces. So stay tuned with that. I just wanted to make sure you all knew that was coming, and very interested to get that specific senior living community property point of view. Okay, with that, I'd love to welcome David Moss into the conversation. He is on the front lines deploying some of this fantastic these fantastic solutions in the market. And so I'm very excited, David, to hear more from the Care Daily perspective, what you see as important today. And I'd love for you to start by telling us a little bit about yourself and Care Daily, and then I'll let you take it away. But you're on mute.
We good?
Yeah, I can hear you. You're great.
Okay, great. Jennifer, I love seeing all of that research. You guys do such amazing work there. Thanks for sharing that. I'm actually currently in Paris in Europe, and we're just seeing this large market shift all over the world, where care is really transitioning from a physical place like an assisted living community into personal homes. It's actually ecosystems of capabilities that come together to help deliver care. So our partners here in Europe and our customers are doing exactly that. So the country of Belgium is, from my perspective, one of the leaders here that has actually funded tech-enabled services in homes and is really pioneering solutions that help people live independently. So these are not just point solutions, it's actually ecosystems. For example, our partners, ADDOM in Belgium, have actually launched a service called Jeremy, which personifies an AI assistant that helps these seniors stay in their own homes longer. The problem is pretty clear, I think, all over the world. If left unchecked, if people are moving out of their homes and into communities and paying for more and more expensive care, the cost of is going to go through the roof. And long-term care could deplete Social Security and long-term care insurance and more. So the possibly even more pressing in the short term, there just aren't enough caregivers.
Oh.
So what we did is we brought together an ecosystem of solutions that goes into homes. And no one company really makes a complete package. We really all have to work together. And it actually starts with PERS. We're seeing the same kinds of results here, Jennifer. It's a solution that the market's already educated about. And it's one of several wedges that can crack open the door for more innovative services in homes. So we see that, many of these solutions also work outdoors too. So it's a nice way in. And then it expands with ambient sensing. So without doing much else, our homes, the actual walls of our homes, can evolve to understand how we're doing today. And that technology within the next several months is actually going to become completely invisible. So before a problem happens, what we're doing is using the software that CareDaily creates to fuse together the data from lots of solutions and put it into the hands of people who can do something about it, the staff, the families, and more. And so that's some of the background here on CareDaily, Jennifer. I am the CEO and the co-founder of the company, and we are working with groups all over the world to bring these solutions into homes.
Well, it's fantastic. Thanks so much for being here, and I'll jump back in to have a little discussion with you in a bit.
Sounds good. Great. Well, let me kind of explain, what we're seeing when there is all of these signals that lead up to a problem that happens, and then there's the problem that happens. So, before a problem happens, the home is actually able to tell that story, but we have to fuse together the data to form these predictive insights. And what we're doing with that is when you can get that information into the hands of the right people who can do something about it, they could actually stop problems from happening. People can live in their own homes longer. Once a problem happens, then you get people like the professional call centers involved, somebody who can actually react. So it's actually two different personas there. You have people who need the deeper insights, the social workers here in Europe, caregivers in the US, who need these insights to prevent a problem from happening. And then you need to get the right people involved when a problem does happen. Part of the ecosystem is actually the multi-generational family as well. We need to not only fuse the data together from all of these products, but we also need to fuse together the people that surround the individual that we're caring for. So we're seeing this in this play out in the United States, in Europe, and other markets. It's these ecosystems that come together and are now shifting into the workflow. So at the heart of all of this are families. And I think every family has some version of this question. Did my mom sleep well last night? And did she get up and did she eat? Is my dad doing okay? And did something change? The answer is usually spread across a whole bunch of people, and it's systems and it's data and it's these little moments throughout the day. So homes may be telling this story, but we're only hearing little pieces of it today. In our studies with the National Institute on Aging in the United States, CareDaily actually proved that by bringing together multiple point solutions, we could have an intelligence that makes it feel human, like someone is there helping the family. So any one point solution didn't answer these questions on their own. But when we could bring them together, we could actually get a holistic view and an understanding. And that's the kind of thing that for us, what we proved when it comes to peace of mind, we can actually quantify it. We can significantly decrease anxiety in the families caring for someone with dementia, and we can significantly improve their sleep quality. But the key is to have an intelligence that makes it feel like there's somebody there helping. So when the home is able to tell that story, we see positive stories. Like, for example, a woman who moved into a community and her family was worried if she was integrating with the rest of the community, if she felt welcome there. And you could see in the data she's getting out of her home and she's interacting with people. So it brought peace of mind to the family that the daughter's mom was fitting in. And it was the insights produced by the software fabric here that helped do that. The homes can also tell stories that we don't want to hear, but we have to hear. Like the woman who had her husband in a skilled nursing room and he passed away, and you could see in the data from her assisted living home that she started to sleep in like a teenager and her patterns shifted dramatically and nobody was paying attention. So it was because of the ambient insights and intelligence that we're able to understand something is wrong and intervene before it really gets out of control. The homes are really telling these stories. The question is whether we're listening. And until a software fabric exists that could really stitch it together, the story doesn't come together. And it can't come together when by any one single company, because no company out there really creates every part of the solution. So for professionals, that story, these answers, the things we're looking at are actually captured today by humans into a system of record. It is the electronic health record platform. And it's a major step forward. This gives the entire industry the system of record when there is staff involved. But the EHR actually just knows largely what people are typing into it today. And more we see, as you were pointing out, some of these AI voice scribes that can help take notes. But it's the assessments and the notes and the care plan and these observations and these events that are manually input today, and they matter, but they're also incomplete. So the EHR can tell us what was documented, but the opportunity here is to understand what's changing continuously from our homes and to combine that together. So we're moving right now from systems of documentation to continuous intelligence. It means that the environment that surrounds us can actually help us understand what's happening today between the human touch points. The staff is getting better context. Families actually get more confidence and they're better connected, and operators can really focus their attention. So we see this shift right now. The workflow is shifting from observations and documentation and reviews to be able to actually respond and sense and understand and help us prioritize limited human attention. We shouldn't escalate to the most expensive person out there. The AI actually needs to be sophisticated enough to invoke the right level of attention without going overboard when we do act. So I'm sure some of this sounds pretty familiar to many of you. We've been talking about this for years. There's smart homes, there's remote patient monitoring and AI and interoperability and dashboards. But what we see right now is a total shift in the industry. The intelligence that I'm talking about is actually moving into the workflow, into the electronic health record platform. And that's really a key. So our homes are now telling the stories that need to be told by listening to the data and the insights from all of the capabilities and the resources that surround us. And it's moved from a nice to have to a core competency within the care workflow itself. And I think this has an effect on the whole industry. At Care Daily, we had the honor of launching commercially with Matrix Care, the electronic health record giant. This is a deep integration, and it's a new capability that has not been seen before. This is not a third-party marketplace add-on. What this signals for all of us is that ambient intelligence is moving into a system where care teams already work. It's a holistic understanding. It's not disconnected dashboards. And embedding the ambient intelligence into these EHR workflows can combine the documentation and the history we've collected with the daily patterns that are happening privately inside of a person's living space in their home. It changes how care is delivered. And that's really important. There are not enough caregivers, and there never will be enough caregivers. And the ones that we have today can't be everywhere at once. So the breakthrough is that the ambient intelligence is combined into the workflow. It is significant, and it fuses the data and the insights with the real-time knowledge of what's happening across the EHR and the ecosystems of capabilities that we can all bring. And it can be personalized down to every single individual. So the human input and the continuous sensing and intelligence is no longer two separate worlds. It can actually meet right where the workflow actually happens. So we've all seen this kind of play out. There's the, integrations have been talked about for a long time. A point solution can capture a measurement and push it into the EHR or interact with the EHR. And, that is interoperability, but it's not an understanding yet. That plumbing can be really useful. But understanding the patterns and the signals requires something much deeper. The ambient intelligence is different from a device integration. What we have to do is we need to fuse the data together. So the data from our environment, which includes the PERS buttons, the motion sensors, the door sensors, sleep monitoring, medication adherence, all of that EHR context, whatever the family has to say too, the staff notes, all of these events need to fuse together intelligently to give us that picture. And the result is that the workflow itself can actually understand what matters right now across an entire population. So instead of a product just injecting a data point into the EHR and another product injecting another data point into the EHR and nobody can make sense of it, now we can bring it all together. We have the opportunity to fuse it. And it's creating meaningful outcomes and meaningful insights that help us get ahead of the problem. It's enabling us to predict what's coming and get ahead of it. So what I'm seeing is that once this ambient intelligence is in the care workflow, then the care can actually reach even farther than it ever has. The technology in the space has always kind of started in higher acuity settings, which typically have staff, by the way. And now the model can actually reach further into the home, into these lower acuity settings, and that's the biggest opportunity. Last I checked, there are more homes out there than all the hospital rooms and skilled nursing and assisted living and independent living beds combined. It's the largest care setting, and it's also one of the hardest places to coordinate. So it's in the homes that we actually have this opportunity to support people earlier in these lower acuity settings before the changes really become expensive and disruptive. But homes are really messy. Your home is different than mine, and your lifestyle is different than mine. It's fragmented, and we don't even have a definition today of like, what is a smart home? So what we need to do is get very personal, and that requires more intelligence. And with more intelligence, we can stretch care across all the way from high acuity settings with staff to low acuity settings with family and friends and neighbors and everything in between. The cool part is that many companies actually already have these assets in the home. You've got your Wi-Fi router might indicate presence and connectivity. Your TV may suggest somebody's there. A security system knows if you're home or away, and some data that actually understands the movement patterns. And the refrigerator can understand the rhythms around the kitchen. So all of these components, the thermostats, the smart speakers, the things that surround us can actually provide really useful context when we can get access to the data. So the home is already generating all of these signals. The signals don't matter if they can't reach into the workflow and interoperate and become a holistic understanding of this person. So all of us have a piece of the story, and many of these pieces are already in homes. It's the ambient intelligence that bridges all of these pieces into a connected care ecosystem. So I think many companies have this wedge into the home that cracks open the door, and you can land and expand. And when you can bring all of these signals together, it can actually create this higher intelligence to help people truly live independently. So a lot of healthcare and the AI conversations around healthcare are, from my perspective, a lot of it has been around tapping into the large language models to summarize notes and capture text and documentation and chat interfaces. And we are seeing a lot of success there. But to have care everywhere, the AI actually has to do another job. It has to understand our patterns in daily life. It is the pattern engine. So it takes many of these weak signals that are weak on their own, and it amplifies them. It turns them into something useful. A single motion sensor might not tell you a whole bunch, but when you can sense across a small ecosystem the change in motion and sleep and the refrigerator use, the medication behavior, the concerns from the family, you can actually get to a meaningful story for every individual person. So it's the AI that helps us move from these disparate signals and fragmentation to the patterns that can cause people to act. So I think that we are seeing AI really play out in not just writing a better doctor's note. It's really about understanding what's changing in our daily lives. And when we blend all of these patterns with the human input and the context, like you might capture in the EHR, you can actually help people act earlier, including the staff and families and call centers. So everyone's got a piece of the answer. The pieces have really operated separately today. Each one of us brings something useful. And when we get a couple of these combined, there's a lot of power. We end up with interoperability, but more importantly, the intelligence, the software fabric, where these pieces become a care ecosystem that can actually be delivered under many brands and distributed at scale internationally. And this market scales when companies can really participate. So companies like Matrix Care have been on the forefront of bringing this into the EHR workflow. They have been at it for years and see what works. Companies like CDW on the solution side can bring together ecosystems into the market and make the personalizations that really work at scale. A telco can bring the connectivity and new data sources that are already in the home and the trust. And a security company can bring the monitoring and the response. The device companies can bring the signals, and the senior living operators can really bring the operations. Our ambient operating system at Care Daily is here to just make sense of all of that. We have all of these capabilities that are tied in, and it's becoming very meaningful. It matters when we can fuse all of that together and help people understand better and do something about it. It's a really positive feedback loop where every contributor who can get in can actually make the total sum of these capabilities even more meaningful. So if you're in healthcare, the home is really not outside of the care model anymore. The EHR and other companies in that workflow should fuse all these human inputs we've been capturing with continuous intelligence that lets us know truly how is a person doing today and who should I focus on today and why. And How is my staff doing, and more. The telcos and the cable operators and the security companies should really recognize that their footprint in the home and the data they generate is extremely valuable and can help people live independently. It actually keeps their customers and it generates new recurring revenues. And the device companies should be designing for ecosystems and partnerships. It's about, the AI does a good job at a bunch of stuff, but it can't replace the human relationships. And just like I am here in Europe with visiting a lot of partners and companies, it's these ecosystems that we're forming that are next generation. But then it's the distributors, the solutions providers who can help assemble all of this and scale it. So I'm going to make one prediction about where all of this goes. As ambient intelligence enters the workflow, it's a game changer. And as we get this deeper into homes, these lower acuity settings, we're going to get more than just operational efficiency and staffing efficiencies out of this. We're actually going to get true longevity. The big vision is to help people live healthier and longer lives. It is all about longevity. And frankly, I like the word longevity much better than the phrase aging in place. My goodness, aging in place sounds like something I would do to a block of cheese and not my grandmother. I want my grandmother to have longevity. And so do people who are young. We are all at that. Longevity is physiological and it's also psychological. It is about setting intentions and creating healthy habits that give us something to live for. And it's these intentions and habits that can actually be measured, both inside the home and if you're in a community, across the community. So I predict that the ambient intelligence and working into the workflows is a first step, and getting deeper into homes is great. But what we're after is these communities that can be intentionally shaped and measured against longevity outcomes using the ambient sensing and intelligence that I've been describing from all of our solutions combined. And I expect one of these outcomes will be to create new blue zones. New blue zones will not happen by accident. They will be intentionally designed and it will be powered by AI. Who wouldn't want to live in a place like that? Families are still asking, how is my mom today? And for decades, we've answered that question through visits and phone calls and notes and charts. And it's a lot of human effort. And that's going to continue to matter. But what we can do is add something new to this. When we have the software intelligence that is deeply embedded into the workflows and able to scale through massive distribution channels, that combines all of the daily patterns with all of the human input and all of this continuous intelligence, and you end up with an ecosystem that more and more companies can participate in. So thank you very much, Jennifer, for allowing me to share my perspective here with you. And I'm happy to take some questions as well.
Yeah, absolutely. Thank you so much for that talk. And actually, the main question we have in here for you, you answered beautifully, but I want to call it out because I actually checked. This is not a Care Daily person who asked this, okay? Because it set up your talk like specifically. It says one barrier associated with innovative implementation with health systems, particularly in the area of software, is if there is compatibility with Epic electronic health records, is there a corollary in senior care innovation? And that's why I think what you're talking about is so impactful, because when you're talking about this relationship with matrix care being a giant in post-acute and hospice, in SNF, right, and for home care agencies, private duty nursing, all that. So you're really seeing that compatibility playing out, with these types of partnerships. One thing, if we just have time for maybe one additional comment here, I'd love maybe if you could flesh that out in a real example of how these deployments are working, right? So you talked about your work in Paris and in Belgium, and so maybe one of those examples, or even in the US, about how these deployments really work, where you're bringing the ambient intelligence incorporating it into the EHR, like what does that really look like?
Yeah, sure. Okay, so actually you kind of take it by care setting, and there's different entry points depending on where you are in the continuum of care. So in some cases, as you get higher and higher in acuity, you want to go deeper on some of the safety elements, fall detection, for example. But it's not just detect; you have to predict. So, for example, combining the medication information from the EHR with any biometrics and notes that have been captured with grip strength and things that can be measured, the tug test, and our partners, for example, at Able Assess, able to capture a quick 5-minute fall risk assessment. Great. It's a set of data points that come together. With the medication adherence products, there's many of them out there. We need to know if somebody's really taking their medicine or not. And then you can see how the patterns change when they do or don't. And then finally, things like sleep. How did you sleep last night? If you didn't sleep well, you're at a higher risk of a fall today. So these signals combined that incorporate the EHR and the inputs, they can actually create the algorithm that is, you're not really predicting that a fall is going to happen at a certain place in time, but you can predict where you should be focusing your attention on who is likely to have a problem today. And so you might not be able to stop the fall, but if you knew one was coming, you can get ahead of it and you can pay attention. So those are some of the examples. In homes, we see entry points like you were pointing out, wearables, and then also we are a big fan of monitoring the bed. It's sleep. It's like one thing you can monitor, but I think more and more everybody wants kind of the daily activities across that living space. As you get up in higher acuity settings, it shifts from just the daily activities around that space into more of the deeper fall radar solutions and more stove fire protection. So the thing is, we have you look for the common denominator, lowest cost entry point that's easy to communicate with the family, and then use that as the launch pad to land and expand. And as you pull in some of these insights, you can actually make predictions and get ahead of problems and keep families connected and keep the staff connected. So there's a bunch of strategies around here, but at Care Daily, we're not making any of the hardware. We're stitching the pieces together and enabling for any one of these care settings to have the right ecosystems to start with, but the ability to future-proof their strategy by being able to have access to a whole ecosystem of capabilities.
Yeah, that's what I think is so interesting is that, I mean, this really is an ecosystem of many, many devices and services, and what's needed very much does differ depending on if you're in the home, who's watching for these signals. Well, it might be the the family themselves, or it might be a home care agency. Now you get into a community setting. Well, maybe it's the community staff who's looking at it. Can those insights be brought into an emergent setting if somebody is, admitted into the hospital? And so you have all of these connectors of different opportunities for business opportunities, honestly, for the services that go along this, but also ways in which the data and the information could be surfaced. Unfortunately, we don't have any more time. We have to get to our panel, but thank you so much for taking the time to walk us through what you guys have been up to and how you're seeing these integrations plus the intelligence bring ambient together with the EHR to move the market forward here. Thanks so much for your time.
Thank you so much, Jennifer. Exciting times, and I look forward to connecting with many of you.
Awesome. Absolutely. So I'd love to invite our panel at this time to join us. They'll be talking about the new front door for care, bundled smart home solutions. And I'm going to hand it over to Kristen Hannick, our Senior Director at Parks Associates, to lead the panel.
Thanks so much, Jennifer. I very much appreciate it, and very happy to be moderating our panel discussion. Looking forward on diving into this subject. As Jennifer mentions, we are going to be, for the next 45 minutes or so, really diving into this subject, which is bundled smart home solutions, and looking at those as this new front door for care. Next slide, please. Yes, I'm Kristen Hannick, Senior Research Director here at Parks Associates. I lead our coverage of a few different areas, including some of the work that we're going to be doing, especially when it comes to senior living communities, My academic background is really in this field of public health. So a lot of I'd say same considerations as when it comes to this, as David said, not necessarily aging in place, but certainly aging at home, as well as the more formal community settings. So joining me today are an excellent lineup of panelists with a wide and diverse range of backgrounds, including Ryan Bangeter, CEO of Meritex, Logan Harper of Boston's Children's Hospital, Sarah Jones with Be Well Connected Health, as well as Joe Velderman with K4 Connect. So before we actually dive into this panel discussion, let's do a quick round of introductions. Maybe you guys can tell our audience members a little bit more about yourselves and your companies. And maybe Ryan can kick us off.
Sure, would love to. Thanks for having me. I'm Ryan Bangeter with Mitrex. Mitrex is uniquely vertically integrated with in-house design, engineering, US-based SMT manufacturing, medical monitoring services. And this October, it actually marks our Mitrex's 40th anniversary. During those 4 decades, Mitrex has been focused on helping people live more safely and independently. And today we're seeing a significant shift in how care is delivered in the home. So traditionally, personal emergency response systems, PERS, were viewed as reactive solutions, something you used when an emergency occurred. But today, the opportunity is much bigger. So by combining personal safety, remote monitoring, caregiver engagement, actionable insights, our goal is to transform, and we're helping transform the home into a connected care environment. So to support growing demand for connected care, we built a network of strategic partnerships that complement our vertically integrated capabilities. And that's really what this slide, represents. At the center is the home, surrounded by the people and technologies that support better outcomes. And ultimately, we strive to create solutions that serve as a conduit to keep grandma and grandpa connected to the outside world. So, and like the slide references, we believe the future of connected care won't be built by platforms alone or a single product alone. It'll be built through partnerships and that bring these capabilities together into a seamless experience. So thanks for having me. I'm looking forward to the discussion.
Very happy to have you joining us, Ryan. Certainly looking forward to hearing more. Of course, joining us as well, Logan Harper with Boston's Children's Hospital. Can you tell us maybe a little bit about yourself and what you do there, Logan?
Yeah, absolutely. Thanks for having me, and pleasure to join everyone here today. My name is Logan Harper. I am a product manager for digital health solutions and services here at Boston Children's. While focused on pediatric, my background before joining Boston Children's over 4 years ago was more in the adult space. So bringing in that expertise, both from the adult space and the pediatric space, which has a little bit of its own uniqueness, which I think ties in well to today's conversation. So I'm responsible for launching innovative and new digital health solutions throughout the hospital here at Boston Children's, and scaling that system-wide, and then sharing those with others throughout the world. So pleasure being here today, and look forward to this conversation.
Thanks so much, Logan, and very much appreciated. Of course, we also have joining us as well, Sarah Jones, Chief Outcomes Officer with Be Well Connected Health. Sarah, so glad to have you here. Can you tell us maybe a little bit about yourself, your background in Be Well?
Sure. Hi, thanks for having me. I'm Sarah Jones. I'm Chief Outcomes Officer at Be Well, and a fun fact about me is I have spent probably the majority of my career in aging in place and connected home, and had the opportunity to participate in a number of parks events in the past. So it's super fun to be here and have the opportunity to bridge the Be Well world with some of the aging in place world. So I am personally very excited to be here. If you haven't heard of Be Well, we build the platform that powers personalized connected health experiences. So really, at the core, we think the reason that healthcare has never felt like a consumer experience is that no one ever has a complete picture of you. So your clinical history, your benefits, your medications, your wearable data, your behavioral data, all of that is in disparate places. And if it was in all one place working together, you would have a much better, more consumer-oriented healthcare experience. And that's what we've built. A longitudinal health record that unifies data from all of those different sources. We have the largest connected network of clinical and wearable and payer data that helps actually activate people in their own health. So it creates personalized recommendations, alerts on care gaps, benefits navigations, provider search, all in the context of a person's specific health story. So hyper-personalized to their exact health needs. So it's not just generic wellness content, it's stuff that actually gets people to do stuff. So that personalization creates a flywheel. The more a person engages, the more rich their record and data set gets, the more personalized their experience becomes, and then the more they engage. So that's how you can create that sustained activation. It's not just downloading an app or wearing your wearable, it's actually engaging with your story. So BeWell is the data backbone that makes that health data actually connected. So we help power AI and consumer experiences that sit on top of that data. We've got a white labeled app, we have a white labeled AI assistant, and we power health experiences for some names you would know: Samsung, Google, Perplexity. All of our platform unifies that data and turns it into AI ready longitudinal health records that organizations can build on top of. So what we bring to the conversation is pretty relevant from that health, the interoperability and the front door perspective. Happy to be here.
Yes, thanks so much, Sarah. And I'm looking forward to hearing what you have to say. And I think I've seen some of the results coming out of BeWell, but very impressive stuff. Joining us as well, Joe Viderman, Chief Strategy Officer with K4 Connect. Joe, can you tell us a little bit about your work at K4 Connect?
Yeah, Kristen, thanks so much for having me. My name is Joe Velderman. I serve as Chief Strategy Officer at K4 Connect. I've been kind of a lifelong aging services technologist, working on, I think, 23 years in the field. It's virtually been my entire career. And, you know, at K4 Connect, we started with a very similar belief to what David did a great job of explaining during the keynote, that the home is a great place to learn about what's happening. And so we launched our resident engagement platform for aging services providers, senior living communities about 13 years ago, with the premise that IoT data, voice data, smart home data is all really, really valuable and can help providers more meaningfully engage with the consumers, but also help consumers you know, more meaningfully and creatively engage with the place that they live at. And we've since evolved that. You see the Fusion OS logo on there. It's interesting that David used the word fusion, I think 5 or 6 times in his presentation, and our platform is called Fusion OS because it does exactly what David was describing. It takes data from dozens and dozens of disparate sources: EHR records, point of sale platforms, menu management platforms, facilities, IoT devices, wearables. It fuses it all together. It's an interoperability platform. It's an integration platform as a service, but it's also a data centralization platform. And we then take all that data and we apply it to large language model AI tools. And we're currently in the process of building agentic AI personas that take on the role of traditional senior living workforce members. So we have a wellness enabled agent that will be coming out here very soon. We have a concierge agent that will be coming out here soon. And we envision a world in the future where there's going to be just dozens and dozens of different agents that have very vertically aligned training on specific tasks, specific responsibilities, to be able to really augment caregiver experiences, be able to augment resident experiences, be able to augment family experiences, and be able to do a lot of that critical thinking that's currently missing in aging services. So again, with the rest of the panelists, I'm super excited to be here. It's a great topic that we're unpacking. I don't know if we're going to have enough time, but we'll do our best.
Yes, and thanks so much. I think if we go a little bit over, we should be fine. The platform isn't going to kick us out, but very happy to have you here with us today, Joe, and really very happy to have everyone with us. Let's dive on into this subject. Interested to hear what you guys have to say and your perspective on some of the more recent market trends. Though let's maybe start off with a more general question for our audience members. So what are some of the smart home and IoT solutions that you see being used for care today? And this can be when it comes to the in-home settings or even some of those more formal community-based settings. So what are these solutions that are being used, and how maybe have the expectations of patients and consumers been reset when it comes to technology? And Joe, maybe you can kick us off.
Sure. I think the 40,000 foot answer is there's a lot of different devices that are out there that are all really valuable from a data perspective, right? The honest answer is that I think the device layer has largely been solved at this point. What's changed is the expectation layer. Today, when you look at senior living, you'll see voice as maybe the dominant interface because there's no app to learn, there's no stigma. Residents just talk to their home. And around that, you've got ambient and passive sensing, you've got motion sensors, bed sensors, chair sensors, maybe door locks, environmental monitoring. David mentioned wearables, and then the evolution of the old pendant into automatic fall detection that's happening as well. So across, the hundreds of communities that we serve at K4 Connect, voice and connected care devices have really sort of become table stakes. What's reset is the baseline. Adult children expect their parents' apartment or their home to be as smart as their own home, and they expect safety to be ambient. There's no button to press. There's no pendant to remember. It's all become predictive based off of this intelligence that's running in the background. And so we've moved from reactive care where something bad happens and someone pulls a cord to more proactive care where the environment is quietly watching for the change before the fall. And that's been the real shift. The expectation is now invisibility plus reassurance, not just gadgets, but there are literally hundreds, maybe thousands of different gadgets that all provide a great value into that bigger data strategy.
Yes, absolutely. I think that at Parks Associates, we've seen the smart home has become largely mainstream. It hit over 50% adoption earlier this year among what we would call our core smart home device products. Smart speakers, as well as you're saying, have very large wide-scale adoption. We've seen smartwatches actually grow to nearly 40% adoption. So these have become very common household technologies, not just among kind of younger folks, but really all generations are adopting these, and raising all sorts of new expectations and interesting possibilities. I think Sarah at Be Well, you guys touch really a lot of different data points. What are some of the things that you're seeing when it comes to kind of these devices and solutions and changing expectations?
Yeah, I think the real short answer is the healthcare system is as a system behind where consumers are. So research came out earlier this year, 30% of consumers are already using, I think a third, 3% more are already using AI to get health answers. So, and 40, you're citing different stats, 40% of adults are wearing wearables. So there's that piece. And then there's, as the modern world has interacted with consumers, they expect experiences that are better than any member portal that I interact with today. Those things are just, right? Like you can have a better consumer experience. Walmart, Nordstrom, Amazon all know you better than your doctor does. And so the healthcare system has been behind what those consumer expectations are. And so that's a challenge. I think there are reasons for optimism though. The health tech ecosystem that was announced in August by CMS and the administration has been moving faster than I've ever seen the industry move from an interoperability perspective. And the whole premise of that is let's make it easier for data to move around the healthcare system. And we're seeing 700 plus companies sign on for different use cases, whether that's conversational AI, disease specific things, or patient facing apps. So I think the industry knows they want to solve their problem. They can't quite get out of their own way. And that doesn't even start to talk about like the people who are delivering care that are outside of like the epic world of care, the senior living, the dermatology, vision, dental, all of that data is really that whole person story. And so the health tech ecosystem, I think, is nice. It's welcoming everybody. It's starting in that more traditional space, but I think it'll be a really big opportunity for people who are thinking about aging in place, whether that's in senior living or in their home, to participate and be able to both improve the experiences of the people that they are caring for and have more access to data to better identify where people are that might need assistance.
Yeah, so as you're saying, it's the medical industry is one of those industries that have lagged the consumer space by, I've heard people say over a decade in some cases. There's just a lot of, I think, challenges when it comes to bringing in some of these different types of technologies, but some of the more recent movements are having me very optimistic.
Yeah, I agree. It is lots of reason for optimism and equal parts frustration.
Yes, yes. Ryan, what are your thoughts on kind of where this is all going and where you see maybe the space headed?
Yeah, I think I agree with Joe and Sarah. I don't want to repeat what they said, but ultimately, I think what's really changed is consumer expectation. People really no longer expect a device that only works during an emergency. They expect a connected experience, similar to what they get from their smartphone, their smartwatch, or other consumer technologies. Whether that's in the circle of care that's signing their loved one up for these services, or the end user or the patient themselves. They want real-time visibility, simple setup, mobile apps for caregivers, proactive insights, and actionable data. I think one of the misconceptions in the market too is that, as solutions provider, we can go down rabbit holes, I think collectively, not, of just gathering so much data and passing that raw data to caregivers or the circle of care. And I think that's missing the mark. I think it's really the shift that we're seeing from reactive emergency to proactive care. I think that it has to be in conjunction with or partnered with actionable data, and a cohesive solution. So again, I think the expectation from, call for help when something goes wrong, to help me stay in my home. I think it's more help me stay well so nothing goes wrong in the first place. And so I think, you see all the different emerging technologies. PERS plus fall detection obviously has been around for, over 20 years. But I think that it also acts as a gateway for opportunities for cloud-based systems to also marry various technologies together. Various partnerships we've formed, for example, would be with remote patient monitoring platforms, capture vital signs and health data in an integrated turnkey fashion. Because I think that's a big part of this solution that's missing in terms of on a macro level, right? Being able to marry all of those into a cohesive, all of the different options and features and demands into a cohesive turnkey solution that is intuitive, from smart sensors, passive monitoring, voice-enabled assistance, for example, audible reminders to take medication, take vitals, press your help button to test, etc. So I think I'm encouraged by the way that everything is going. I think it's been a long road. I think these topics have been talked about for a very long time, and I think we're continually seeing movement in creating cohesive solutions.
Yes, it's one of the things that had been talked about for years, a decade ago. So certainly some challenges in kind of getting this kind of rolling it up to speed. And I think one of the so you were talking about having this maybe designed and built into this sort of cohesive platform, have everything really dovetailed together nicely. I think we were talking a lot about some of the different solutions, of course, that you guys are offering and the areas you're playing in. So having, again, all this data flow together nicely, be aggregated together, really solving a lot of these key fragmentation challenges that have just been plaguing the health tech, medical tech space for absolute ages. However, when I think about, again, some of the challenges that folks have been coming up to, and a lot of it is really coming back to, we have so many stakeholders in this space that is maybe unique compared to the consumer markets or other markets. So you have the person who is actually receiving this care, of course. Typically at 2026, they're more likely to be of the baby boomer generation. So a lot more tech forward and tech using maybe than the generation that would be going through this care a decade ago or 2 decades ago. You have, of course, the adult child who's typically in the loop, and maybe they're Gen X, maybe they're millennial. Oftentimes they have their own kids. And of course you have different care providers who could be any type of care provider in a number of fields. But typically they're getting hammered, I'd say, a lot by this increased workload that we've been seeing over the past 5 years. And it's been just this enormous, I'd say, challenge for them. So thinking about these diverse stakeholders, maybe their needs, and especially with care providers, having all of these new reporting requirements on them, how are you kind of designing these solutions to really fit these folks and take away some of that reporting burden, but make everything as maybe streamlined, maybe as smooth as possible? And maybe Logan, you could kind of address this from your perspective, kind of working with children's.
Yeah, absolutely. And it it also ties into the ending of that first one of, kind of that reset. It's, you have to have actionability over sort of like data. And so, like I said earlier, the device side's kind of solved, data's coming through, but, you have to make that data digestible and actionable to everyone involved. And that's not just the patient or end user, but also the care team and provider, providing them the right insights at the right time. And that expectation is there on the patient side. I mean, there's a lot of AIs that are kind of helping digest that for patients and simplifying that. On the clinical side, it's a whole other beast when you think about, providers and clinicians, physicians. They start thinking about the legal risks that are involved with that, and how do they address this? Because humans, we're not machines, and so it's almost impossible to have that 24/7 oversight there. So how are you going to solve to keep sort of that satisfaction and keep patients engaged? I mean, you have to have a conversation about that data with the end user. If you're just collecting it for reporting sake, patients, you're going to drop off. You're going to lose engagement. You're going to lose buy-in from everyone involved, even the physician and care team. So you really need to have that actionability over volume of data and getting that at the right time to the right people. So the value is in the signal and not the noise there.
Yes, and so just also thinking about kind of the workflows that these folks are in and how to maybe embed that meaningfully kind of in there and in that process. I guess Sarah, do you have any thoughts about how to kind of embed these solutions kind of meaningfully into the workflow in such a way that it minimizes some of that burden on care providers and maybe family caregivers?
Yeah, I think the name of the game is really semantic interoperability. So not just technical interoperability. There's been years of, did my lab report get over there and it's in a PDF buried somewhere that a clinician is literally never going to click to, won't even know it exists. And so the industry has been doing work on this for a long time. And like I said, the momentum is increasing to move everything to that semantically interoperable standard, which is FHIR, FHIR. And so BeWell actually helps solve for this. We can take tons of different data types, sources, inputs, and translate that into FHIR. We clean it, normalize it, and standardize it, and then put it into that FHIR resource. And so that lets somebody like Logan at Boston Children's say, okay, I know where I want this resource to go. I want it to be in the workflow here. So we really think about ourselves as sort of the pipes to get to those solutions. I think it will be really interesting when you start thinking about how does that FHIR standard translate out into senior living. Admittedly, I'm like less versed on how people like point click care and other EHRs are doing some of that interoperability. But the nice thing about the open standards that the industry is moving to is it really lets anyone adopt it. So we're seeing consumer devices being able to, my new Fitbit Air, Google Fitbit Air will be able to be translated in. And then as I share my records with the hospital, those steps and things will be in a thoughtfully placed. It maybe isn't everything, but it's things that are clinically relevant, maybe clinically relevant to me. That stuff will get into the workflow so that it's actually a normal part of the conversation rather than, doctor, would you like to see my step data? And the doctor's like, I don't know what to do with that. So there's a lot of like solution designing on the provider side because there's a lot of new inputs, but the way that all hangs together is through that semantically interoperable data layer. And that's the piece that's really been missing so far.
Yes. So I think the FHIR, as you're saying, has become more widely adopted, more widely kind of integrated in these different types of EMRs, EHRs. So we think point care, we think matrix care, so the others on the market. So I say there is a lot of new opportunity, new potential there. Thinking about kind of what's going on in the senior living market, some of the different considerations. A lot of times they also have to report different kind of results to CMS and then the payers, also for different regulatory compliance steps. And I think that's kind of another piece of the puzzle here when we think about kind of the streamlining clinician workload and kind of so on and so forth. And then I guess, Joe, what are your thoughts?
The conversation around interoperability and longitudinal health records, that's been a long conversation that's been happening in senior living. I remember, in the early 2010, shortly after most of the aging services providers in the country adopted EHRs for the first time as a result of the American Recovery and Reinvestment Act, there was a lot of conversation around being able to exchange records with hospitals, primary care providers, et cetera, and a lot of challenges associated with that in data formats and how we measure things versus how other people measure things, and security and privacy and all that kind of stuff. But the desire has always been there to exchange the information. I think what's been missing is the motivation, because it's one thing to be able to create the interoperability and have that desire. It's another thing to be able to put a clinician in front of all that data and say, synthesize all of this while you're also providing care to that person, right? You take a nurse or a CNA, and they may have a caseload of 20 people that they're taking care of on a given shift, and you ask them to synthesize years and years of raw data. That's a tall ask. You might have a physician that has a panel of 100 or more patients or residents. You ask them, to synthesize years of data while they're providing care for somebody. And that's a really tall ask. And so that the barrier, I think, has always been sort of the ability for provider organizations and providers themselves to be able to synthesize longitudinal health records. And so, that's sort of been a lacking motivator, if you will. We've solved for that today, though. AI is really good at critical thinking and really good at synthesizing data. And so all of a sudden being able to, I love what Logan said about right data at the right time. I call it the 5 rights. It's the right data to the right person at the right time so they can provide the right care in the right place, right? And AI with lots of data can synthesize that and can make that really relevant at the right time to the right person so that they can, have that synthesized information to make the right decisions about care that's being provided. And so I think that's that motivator that's been missing for a long time, that ability to do that critical thinking in the moment with tons and tons of data is suddenly solved. And now everybody's really excited about creating these longitudinal health records, these comprehensive health records. And then specifically in senior living, when I look at the broader US healthcare ecosystem, most of it's episodic. And there's nothing wrong with that. I'm not saying that there's nothing wrong with that, right? But I go in to see my primary care physician twice a year, and he looks at my 5 or 6 vital statistics and he goes, "Yeah, you're in good shape. Go get a blood test, and we'll review the results of that." That's a glimpse into a window of time, right? But in senior living specifically, we have the privilege of working where people live every day, and we have tons of data about them. We know what time they wake up in the morning. We know how many times they went to the bathroom the night before. We know what what they're having for breakfast. We know what their nutritional content of that breakfast is. We know what events and activities they're participating in. We have RPM data on them. We have wearable data on them. We have sensor data on them. And so, our opportunity in senior living, I think specifically in a congregate senior living setting or even in the home, is just incredible because it's not episodic. We see these people every day. We're collecting data about them every single day. And the ability now to apply AI as that critical thinking component to this mountain of data just became super, super powerful in being able to provide that right data to the right person at the right time so that they can provide the right care in the right place.
Mhm. Yes, and there's just I think ever since the Internet of Things kind of first launched, folks had been discussing about what we could potentially do eventually with all of the data that had been collected, and now with AI, we're actually able to do a lot more than maybe the several years ago even. So certainly quite a lot of new potential being unlocked there. Though I am curious, so we've been discussing things. We mentioned we do see voice assistants, kind of the ambient sensors, connected health devices. They've begun reaching this more mass adoption. It's something that a lot of consumers are familiar with. They have in their own homes. I think of my own parents who are of the baby boomer generation. They have more connected devices than I do. And so that's, I say a lot of opportunity maybe for this this next wave of folks who might be going into some of these care settings or be adopting some of the at-home kind of assistive technologies. But when we are kind of looking at these types of solutions, there's still some questions from clinicians and care providers about how maybe clinically relevant they are. And a lot of them do still have this perception that it's maybe 10, 20 years ago, and then that the folks coming into these settings wouldn't really be using these technologies. So the silent generation might not be using the technologies. So how do you kind of validate these types of solutions for clinical residents? How do you kind of prove that the folks are actually going to be using them when it comes to kind of working maybe with care facilities? And I guess Ryan, any thoughts there?
Yeah, I think one of the biggest lessons that we've learned is that accuracy alone isn't enough. These types of solutions, they can be technically impressive, but if people don't trust it or understand it, or continue using it, which are all interrelated, it won't create meaningful value, right? So when we evaluate emerging modalities, like voice assistants, ambient sensors, wearables, smart home technology, etc., kind of look at 3 things. First, like I mentioned, is reliability and signal quality. So we're generating information that's actionable, or we ask ourselves, are we generating information that's actionable, or are we creating noise? which we want to avoid. The goal isn't collecting more data, like I mentioned before. It's identifying the meaningful changes that can support earlier intervention and continual utilization of the solution. Second is more of a user acceptance and engagement. So getting them involved, helping them I think education is a lot of that, but also making it turnkey and easy is very important as well. The third would be more outcome validation. So we work with partners to understand whether these type of technologies are actually improving safety, engagement, caregiver confidence, helping people remain independent longer, in their homes. That's ultimately the test that matters. That's the outcome that we all want. So, in other words, I guess I think the future really isn't, passive monitoring versus active engagement. It's really in combining both of them in a way that's actionable, delivers an actionable insight that leads to interaction without adding burden to the individual as well.
Yes, I think what we saw about 5 years ago during the pandemic, there was a lot of data generated at that point in time that effectively validated some of these different types of interventions and solutions at scale. And that is also continuing to resonate its way through the market. So having those good clinical results and having some of the hard ROI there really be visible and be surfaced. So we do have kind of more questions to get to in terms of the panel discussion. We've also had a lot of questions coming in from the audience members. So audience members are very interested in the discussion and have some hard-hitting questions for you guys. So I'm going to take a few of those and pose them to you, and anyone, of course, who would like to take a stab at that, more than welcome to. So we did have this one question coming in from Mike. So Mike is asking, who is going to drive the adoption of some of these different types of solutions? Is it going to be the medical community that's the driving force, home healthcare companies, or the families themselves?
Yeah, I can take that, Kristen. I think the answer is yes, all of the above. But I'll say I don't think that the answer is retail. We've seen retail try this a couple times, and I think consumers don't trust retail to be that connected to their health. And so I think it could very well be families that are going out and purchasing that this technology and helping to implement it and drive adoption. I think from my perspective, I think the greatest opportunity for success is when you associate a trusted healthcare brand, like maybe a Boston Children's Hospital, for example, or a Cleveland Clinic or a Mayo Clinic or a senior living brand or something like that. When you can attach that brand as a trusted brand to the tech, it certainly it quickly gains credibility, and I think that's going to be our biggest opportunity to drive adoption.
So it's really leaning on kind of the brand and the expertise of some of the larger medical players. We had another question in. Were you going to answer, Sarah, as well?
I was going to say, I don't disagree, but I guess the success of the Galaxy Watch, the Oura Ring, the Apple Watch would tell me that consumers are already trusting those brands. And I will tell you that I can personally tell you, based on what I know of our customers, that consumers are taking and putting their health records into those experiences. They're putting it into, so I think there's more trust. It may be a generational thing. If we looked at the slices of, like, is it seniors versus 40-year-olds versus 20-year-olds? But I think there's already a lot of blending between what was traditional healthcare and what are consumers trusting from a healthcare perspective. So I'm less convinced that Boston Children's is going to have to do the heavy brand lifting, but I do think that can help accelerate it in a lot of use cases.
Yeah, and I think to blend kind of both of those responses from Joe and Sarah together, I had a clinician here at Boston Children's tell me essentially that adoption is going to follow dignity, that if the technology feels like surveillance, then people are just going to opt out. But if it feels like it's independence, they keep it. So, designing for the feeling first. So thinking of like the Whoop and the Aurora, rings, those are very, passive. And it doesn't really feel like surveillance. And so those are ones that are getting high adoption in the market and are, continue to have use with end users, even with the subscription paying model. They are still using that, 1 year plus out after initially adopting it. So that I think that, both answers have a lot of great feedback, but to synthesize, I think as long as it feels passive, then I think we're good and adoption will continue.
Yes, I think it also helps with kind of devices like these that they are associated with athletes, so people who are very active and fit, so overall very, very healthy. So it doesn't necessarily have any of the stigma that people might have around types of other types of potential technologies. So yes, another question in from the audience, Justin. A comment was made that the device layer has largely been solved, but there are actually a lot of devices available. Sometimes it's hard to know how to move forward, given that all of the devices are here. What can companies do to sow clarity instead of confusion, kind of in the device space? And how do you know kind of what would be actionable versus what is just noise?
Well, I think I made the comment about the device layer being solved. What I meant by that was, there's such a proliferation of different devices that all provide great data today, right? You could look at a very simple smart light switch that you can probably buy for $20 on Amazon, and it pairs with your Wi-Fi, pairs with your Alexa device or something like that. And the value of the transactional data that's coming from that very simple light switch is super valuable if it's placed in the right room of the home, right? For an older adult, maybe that's the bathroom. I see that bathroom light go on in the morning. That's an assurance to me that mom is up, doing well for the day, and I don't have to worry about her. I see that bathroom light go on, once a night. That's normal for mom. But all of a sudden I see it go on 3, 4, 5 times a night. That's not normal for mom. Maybe that's an indicator that mom has, an infection or a urinary tract disease or something like that. And so, I think what I meant by my statement about the device layer being solved is that there's tons of devices. There's doorbells, there's Ring cameras, there's thermostats, there's wearable devices, the rings, the personal RPM devices, the blood pressure cuffs and the scales and all that stuff that can really be purchased and sourced from anywhere. They all provide great data. I think for providers, it's about outlining what's the most valuable data for me to be able to get. Is it just presence in the room? Is it knowing what transactions are happening in the room? And then, I look at the sensor space too. The sensor space has evolved so much over the last few years. We have computer vision AI with cameras. I'm not personally a big fan of the camera because I think the camera, lends itself to too many privacy issues. But there's millimeter wave sensors, there's radar sensors, there's ultra wideband radar, there's LiDAR, there's thermal. Just all kinds of sensors now that can detect sleep information, presence information, heart rate information, there and many more. And so I think the question for providers is let's work back from our destination. What's my destination? What data am I trying to get? And then what's the right tech for me to purchase and put into a person's home to be able to collect that data?
Yeah, I'll give you a quote from a provider I talked to before joining this panel, and I was asking them some of these questions that were going to be asked because I wanted to be able to provide some clinical quotes. And here's what this cardiologist told me, that we need to stop holding these home-based sensors and devices to ICU standards. The right question isn't, is this as accurate as a hospital monitor, but is this accurate enough to change clinical decisions? That's a much more answerable bar, and that's the kind of mindset we should have when we think about these devices and implementing these devices as well. So that's one little nugget I wanted to kind of leave here.
Yeah, and I think an example of actionable data versus just data in general, raw data. I guess an example of that would be that was part of the question, right? In terms of right. I think an example of that would be, we can collect steps per day, but that alone, if I'm taking 12,000 steps a day, that's great. I'm pretty sure my grandma doesn't take 12,000 steps a day. If she takes 3,000 steps a day and a caregiver sees that, or someone in the circle of care, they might look at that and say, man, mom needs to move around more. She's got to get her steps in. Well, at the end of the day, she might have increased her steps that day by 15%. So it's all relative. The data is all relative. There's no one metric that fits all, right? And so that's the type of actionable. So that snapshot of a single occurrence, how many steps did they take per day? That's great to know. But however, the bigger picture is how many steps, what are the trends? How many steps a day has she been taking over the past month, over the past 3 months, 6 months, 9 months, a year? And how does that correlate, right? How many times does she, it looks like mom went to the bathroom at 3 a.m. today. Well, did she also go to the bathroom at 2 a.m. and 4 and 6 and etc.? And to Joe's point, that's evidence of possible UTI, which is a major problem in the aging population. So I just want to point out that those are the examples of, as solution providers, I think we all deal with this as well, of what data do we show the circle of care or the providers versus how do we show them the information that they want. So I think communication and collaboration is a massive part of delivering the actionable care.
Yes, just making sure it's really as relevant as possible. So we do have another few questions in. So lots of excitement from the folks in the audience. Next question, kind of asking. So a lot of you guys here have been talking about how you're bringing AI to the forefront and different kind of AI initiatives that you're doing. So Rajan is interested in hearing about what are the guardrails maybe required for this, especially bringing this into making a really a safe, secure health ecosystem. So talking about kind of trust and the importance when it comes to healthcare operations.
Well, I'll kick us off on this one too. This is a super important question, right? Because this is all really new technology. Outside of, I think, 3 states, it's still largely not regulated across the country here in the United States. And so, it becomes up to the developers of these AI tools and people like all of us on the phone to figure out how we use that with guardrails in a very responsible way. So for us at K4, we do a lot of different things. We simulate AI prompts to several different large languages to weight the responses from the LLMs based off of the quality of the response and the timeliness of the response and the number of tokens that it's going to consume to ultimately try to pick, the best answer. We also obviously are using AI that's embedded within HIPAA protected, compliant spaces. We've got business associates agreements with all of the people that we're sharing data with. We've told all of the public LLMs that we're using that it can't use any of our data to train its models. And so, I think those are high level, some of the safeguards that we're taking, but we're also very tactically working with a lot of our customers to say, you need to continue to have a human in the loop on these things. You can't just take what the AI is doing and 100% trust it all the time. It's going to be right 99.9% of the time, probably. But the 0.1% of the time that it might be hallucinating, there still needs to be a human in the loop, and there needs to be a human accountability as part of that process.
Mm-hmm.
I would add that I think this is probably like the most important question in digital health right now, especially since we know that consumers are already going and getting answers through consumer AI solutions. So healthcare catching up in this area is very important, and I think it's an area that I see a ton of excitement paired with consternation around. Well, what does this mean for us? So at BeWell, we think about three things. Like, the data has to be right. So if anybody's prompted AI or provided provided data to go into AI, it's only as trustworthy as what that data is grounded in. So that's why we do a lot of the work that we do to make that semantically interoperable and all the things we've talked about. But that foundation is super important, and we see significant differences in responses and things like that when that data is less trustworthy. The actions have to be appropriate, and I think that's what you're talking about in that human in the loop piece, to just make sure that stuff is actually what somebody should be doing. It has to know like when to escalate, when to route to a clinician. And I think one of the things that we're working through and we will see is that healthcare companies, for whatever that is, who have like treatment type relationships with consumers, they'll be able to create more structure than somebody like a consumer, like a Claude or a ChatGPT or a Perplexity or whatever, around what are the inputs, when do we want to trigger, when do we want to make sure a clinician gets flagged. And I actually think that's sort of the important thing. So we know consumers are going to look at AI to learn about their lab results before their doctor's appointment. I think healthcare companies would rather that consumer goes to them from a brand loyalty perspective and from a patient routing perspective. So if you are embedding into your solution AI tools, then you can actually say, hey, I know you want to get this sooner. Great. Here's what the AI sees about your lab results. I see you have an appointment next Wednesday. If you don't want to wait, you can call the nurse line and ask a question about this, as an example. And those things allow the healthcare company, I'm using that loosely, whether it's senior living or a provider or a long-term care, to be able to better route and navigate and care for that consumer's experience. The most important thing to me, though, is that the consumer has to be in control. So all of this is built on consent. So the health tech ecosystem is based in the Karen Alliance Code of Conduct, which is all about how do consumers give access and consent to the things that they want to do within the framework of HIPAA and SOC 2 and high trust and all the things that we all do. Consumers can choose where they want their data to go. So Joe, you said like, hey, we make sure that our models aren't using training. Some consumers want that. Some consumers want their data to be part of the greater good of AI, and they should and can be able to consent to something like that. Some want their data to be scanned to say, let me know if I'm eligible for a clinical trial that I might not have known about. And those are all use cases where a consumer can and should be able to do those things. So that's sort of that pillar. The data's got to be right. The actions that you're recommending have to be appropriate, and the consumer really has to be in control from a consent perspective.
Mm-hmm. I know we're a little bit over on time, so I would like to maybe pose one kind of last question to you guys. Let's see, there was a really good one kind of back here. So there had been a big effort a number of years ago about kind of getting these personal health records available kind of really to everyone, so being better able to kind of take your health record with you no matter where you go kind of throughout your care journey. And I think that there had been a number of challenges kind of getting that up and running. Jeff from the audience wants to know kind of how companies maybe like Epic or any of the other big EHR providers how are they able to actually get them to share data kind of throughout? So, and this, I guess, kind of goes back a little bit to what you were saying, Sarah, with fire standards becoming kind of more prominent, and then also some of the different regulations kind of around making sure that this data can be shared.
I'll be super quick because I know we're over. You're right. They've been around a long time, and they've been almost impractical because a consumer previously has had to know where they've received care throughout the duration of their life, have an account, remember their username and remember their password, and then have a place where they want to gather that data. So that still exists. That's called like the patient right of access. So any place that you've received care is legally required to give you your data in an electronic format. If they're not doing that, their information blocking and enforcement on that is coming up. So that's the whole, I know where I went. I've got it. I've already got a MyChart or a Cerner portal or whatever it is. And I can actually pull all that into something like BeWell or something else. What's really changed the game to make this more practical is the introduction of identity verification. So the government actually has said and has used in Medicare, everyone in Medicare can get one, an IAL2 identity verification, which practically speaking is like Clear at the airport, where you can just take a selfie. It's not the exact same thing, but you take a selfie and then we know who you are. We, meaning the industry. You get a little token that says, this is Sarah Jones, and we can go out onto the national networks, whether that's the Trusted Exchange Framework, the brand new CMS aligned networks, labs that haven't so far opened up their patient access APIs, and bring that data in, because I'm Sarah Jones, my address, my birth date, all my demographics, and I don't need to have my portal. I don't need to remember that I went there. So like you can actually go into Google Fitbit or into the Samsung Health app and try it yourself. You can take your selfie and then you can see what records come back. It's still imperfect. It's not 100% accurate. And if you're my age, like my pediatric records are in a basement somewhere. But as much data as I can get, I actually had a couple doctors that came back for me when I did that scan with the identity verification. I was like, I forgot about that. So that actually is a huge unlock for consumers. Sorry, that was less short than I imagined. But
that was excellent. Great to hear. So I'm afraid we are definitely over on time, but thank you all so very much for joining us and for that wonderful conversation. We had a very happy audience today. But before we all leave, I'd like to give a special thank you as well to our sponsors for helping to make this event possible, including Alarm.com, Beckler, and of course Silicon Labs. And we hope to see you all next week again, audience members, for our roundtable, where we are going to be discussing the future of PERS, kind of with the Beckler team and also with PalCare. If you are registered for this event, you are most likely registered for that as well. So just keep an eye on your inbox, where we're going to be sending in kind of the link. But yes, again, thanks everyone. If you have any follow-up questions, these are the folks to reach out to. But hope you all have a great rest of the day and a great rest of your week.